here's the heart right here. The pericardial sac, you can't see that. I'd have to ask you as a question. But it's the same thing as the parietal pericardium. It's just like a membrane bag that surrounds the outside of the heart. There's a double layer. There's a parietal membrane on the outside, and then just deep to that, right on top of the heart, would be the visceral pericardium, which is also known as the epicardium. Again, you can't see it, but it would be the membrane that directly touches the heart. So epicardium right on top of the heart, would the membrane right on top of the heart, and then the pericardial sac would be the membrane just outside of that. The myocardium is referring to where the heart is muscular. So all this kind of dark red stuff is the myocardium. And then the endocardium, again, you can't see it. It would be the membrane that lines all the chambers inside the heart. Now, the apex is the pointy part at the bottom of the heart. And then the base is where it's sort of flat on the top. And it's hard to see because you have all these blood vessels kind of obscuring the top of this. But if you chopped off all these blood vessels, you'd see like a flat top of the heart, and that would be the base. The atria are the top two chambers. So here's the outside of the atria. Oops. And then here's the inside of the atria. The ventricles are the bottom two chambers, and they're bigger. So these are the two ventricles. Where it says right heart and left heart, that's not ever going to be an answer on the practical, but it helps you to know which is the right side and the left side. So right, left, just put it as though it's in you, right side and the left side. As for the septa, the interatrial septum is the wall between the two atria. You're not going to see that on your video. There's no way you can get your cameras in here, but it's this wall. If you just kind of feel between the two atria, you can feel this wall between them. The interventricular septum is easier to see. It's this wall between the two ventricles, so you can actually kind of see that. For the valves, the tricuspid valve and the bicuspid valve are what are known as the AV valves, or the atrioventricular valves, because they separate the atria from the ventricles. The tricuspid valve is on the right side, so it's this sort of flappy thing right here. And then the bicuspid valve is on the left. So it's this flappy thing over here. The semilunar valves are separating the ventricles from the aorta, which is this. So there's an aortic semilunar valve that is between the left ventricle and the aorta. And it's right here. It's number 104, 105, and 106. So there's this valve here. There's another semilunar valve that separates the right ventricle from the pulmonary trunk, which is this. So we open it up, and there's the valve between those two. It's number 101, 102, and 103. There's a pulmonary semilunar valve. The chordae tendineae are these little strings that connect the tricuspid valve and the bicuspid valve to these little muscles on the walls of the ventricles called the papillary muscles. And they look like little fingers, kind of these finger-leg extensions are the papillary muscles. There's a whole bunch of them right there and there. Trabeculae carnae. The word actually literally means in Latin meat struts. So like if you think of like just like a web of muscle, and you see how it looks sort of webby all in the ventricle? That's all muscle, cardiac muscle. So those are the trabeculae carnae. The pectinate muscles. In the front wall of the right atrium, you can see them right here. They're this sort of flat spot in the front wall of the right atrium. The fossa ovalis is where, when you're a fetus, you have a hole in your interatrial septum. So this interatrial septum has a hole in it. You ever hear of babies who are born with a hole in their heart? It means that didn't close. For most people, it closes and it becomes the fossa ovalis. You're going to have to like really stick your head in here to see it, so you're not going to get a video of it, but it's a kind of a perfect circle. If you just stick your finger in here, you'll feel a perfect circle. It's number 81 in here. So when you get your hands on the model, look for number 81 for the fossa ovalis. And then the ligamentum arteriosum, that on this model is this little tiny flap of tissue. It's a little connection between the pulmonary trunk, which is this, and the aorta. On a practical, I always ask it, if I'm going to ask it, well, I can't take that off. I always ask it on this pink heart, because see how it's blue? So at least it's got like a little bit of a distinction there. That would be the ligamentum arteriosum. So so I would do that instead of this one. But you can see it, I just would rather ask it on there. Okay, and then for the conduction system, this is what we'd use. This is talking about electrical activity in the heart and how the pacemaker cells spread electrical activity from the right atrium all throughout the entire heart. The sinoatrial node, or the SA node, is this yellow blob at the top of the right atrium. So that's the SA node. Then the AV node is a yellow blob at the bottom of the right atrium. So it's an AV node. The AV bundle is this kind of yellow string heading out of the AV node. So that's the AV bundle right there. And that leads to the bundle branches, which are these two yellow stripes going right down to the interventricular septum. So those are the bundle branches. And then all the rest of the yellow, the littler yellow strands that are all over the place, those are the Purkinje fibers. Okay, so that's it for the heart.